In this session, we are going to be looking at the topic cyclic vomiting syndrome. Hi, I'm Sharon. I'm working as an assistant professor at College of Nursing. The following are the objectives that we'll be addressing in this session. Cyclical vomiting syndrome, CVS, is a rare disorder that usually starts in childhood. The other terms that are used to address this is abdominal migraine and periodic syndrome. It is characterized by episodes of severe vomiting that have no apparent cause. Episodes can last for hours or days and alternate with symptom-free periods. Episodes are similar, meaning that they tend to start at the same time of the day, last the same length of time, and occur with the same symptoms and intensity. It can occur in all age groups, though it often begins in children around 3 to 7 years old. Although it's more common in children, the number of cases diagnosed in adults is increasing. CVS is difficult to diagnose as vomiting is a symptom of many disorders. Let's address the risk factors. CVS may have a link with migraine. Personal or family history and migraine medicines may help treat the syndrome. Chronic use of marijuana, cannabis sativa, also has been associated with CVS because some people use marijuana to relieve their nausea. However, chronic use can lead to cannabis hyperemesis syndrome, that is CHS, which leads to persistent vomiting without normal intervening periods. People with this syndrome often demonstrate frequent showering or bathing behavior. CHS can be confused with CVS. To rule out CHS, ask patient to stop using marijuana for at least 1 to 2 weeks to see if vomiting lessens. If it doesn't, ask the patient to consult the doctor to continue testing for CVS. Let's look at the etiology of CVS. It is not fully understood. Vomiting episodes may be triggered by emotional stress such as excitement, anxiety, or panic attacks. Physical stress such as infection, exhaustion, overexercising, or lack of sleep. Some foods and drinks such as chocolate, cheese, caffeine, alcohol, or MSG, that is monosodium glutamate. Very hot or very cold weather. Menstruation can cause catamenial CVS. Cold allergies or sinus problems. Motion sickness. Overeating, fasting, or eating just before going to bed. And for some people, there is no obvious trigger. Let's look at the pathophysiology of CVS. In genetics, mitochondrial function can be disrupted by endocannabinoid system ion channels in case of use of marijuana. In neuroendocrine, as in cases of menstrual cycle, where there can be catamenial CVS. Substance use, that is use of marijuana and opiates. Cognitive and emotional factors, that is fear or catastrophizing high stress responsivity. Chronobiology, where there is disruption of the circadian rhythm because of disordered sleep. Development or environment due to early life adversity and chronic stress. All these can cause allostatic or metabolic dysregulation, neuronal excitability, and HPA ECS dysregulation, that is hypothalamus pituitary adrenal axis and endocannabinoid system dysregulation. So here we can address the two things as discussed before, that is CVS as well as CHS. Both are kind of involved together, but the exact reason needs to be identified before making the conclusive diagnosis. Let's look at the clinical manifestations of CVS. Patients can have severe vomiting, intense sweating, diarrhea, sensitivity to light, that is photophobia, severe nausea, abdominal pain, fever, and headache. The patient can feel very nauseous and may vomit for hours or even days at a time. The patient recovers from the episode and feels well but might have another episode perhaps a month later or sometimes even longer. CVS can last for months, years, or even decades. Symptoms can be so severe that might require treatment in a hospital. Let's address the phases of CVS. The first is the prodrome phase, where the patient feels an episode of vomiting is about to start. Patient may have intense sweating and nausea for a few minutes to a few hours, and the patient usually appears unusually pale. In the vomiting phase, it involves nausea, vomiting, and retching. Vomit up to 5 or 6 times in an hour for up to 10 days. Patient might experience stomach pain, be unable to talk or move. Other symptoms that may be present are diarrhea, a slightly high temperature, dizziness, headache, sensitivity to light or photophobia, drowsiness, and drooling. In the recovery phase, vomiting, retching, and nausea stops. Other symptoms improve. Recovery can take a few hours to a few days. In the well phase is the period where there are no serious symptoms. Cycle is usually regular and predictable, with the same symptoms starting at the same time of the day or night and lasting for the same length of time. The diagnosis is by the following measures, such as a proper history collection, assessment of the GI system and nervous system, metabolic and liver function tests which may be deranged, abdominal ultrasound, upper GI or X-ray series, MRI, upper GI endoscopy, and gastric emptying tests. All these tests are done to rule out other diagnoses. If we are not able to find any other diagnosis, then we might conclude to the patient having CVS. Let's look at the Rome 4 criteria for cyclic vomiting syndrome. The patient must have the following symptoms: stereotypical episodes of vomiting regarding onset, acute, and duration that is less than 1 week. The patient must have at least 3 discrete episodes in the prior year and 2 episodes in the past 6 months occurring at least 1 week apart. Absence of vomiting between episodes, but other milder symptoms can be present between cycles. Supportive criteria: personal or family history of migraine headaches. This helps in concluding or to be more aware on what is CVS. The differential diagnoses include pancreatitis, volvulus or malrotation of the intestine, pelvic ureteric junction obstruction, and a number of different tests should be done to rule out any metabolic disorders that may cause vomiting. The treatment algorithm of CVS: once the diagnosis is made, go for the general approach, that is identifying and avoiding triggers, good sleep hygiene, healthy diet, avoid fasting, and stress management. And treat comorbidities such as psychiatric disorders, heavy cannabis use, autonomic dysfunction, migraine. And encourage patient to seek consultation as needed and counseling for cannabis cessation. Assess the severity of CVS. If it is mild, that is less than 4 episodes in a year, brief episodes less than or equal to 2 days, quick recovery from episodes, no emergency visits or hospitalization, provide abortive treatment, that is triptans, intranasally or subcutaneously on ondansetron, phenothiazines, and antihistamine. Also consider CoQ10 use. Whereas in moderate and severe symptoms, that is more than 4 or greater than episodes a year, longer episodes, that is more than 2 days, long recovery from episodes, and emergency visits or hospitalization, provide abortive treatment. The same as before, just adding benzodiazepines to the list, and also give prophylactic treatment, that is tricyclic antidepressants or topiramate and CoQ10. Home management includes: stay in bed in a quiet dark room and take medicines prescribed for this phase of the cycle. Small sips of fluids such as water or diluted squash to prevent dehydration. After the vomiting episode is finished, to drink plenty of fluids and to gradually start normal diet again and take medicines prescribed to prevent future episodes. Medical management includes taking antiemetics, that is ondansetron 8 mg sublingual, analgesics, antacids, antimigraine therapy, sumatriptan 20 mg intranasally or 6 inches subcutaneously, and propranolol. Antihistamines, that is diphenhydramine, 25 to 50 mg. Hospital treatment is necessary if the symptoms are severe and IV fluids need to be administered. CVS can be tried to be prevented by avoiding known triggers such as certain foods, getting enough sleep, treating any sinus problems or allergies, taking steps to manage stress and anxiety, eating small carbohydrate-based snacks between meals before exercise and at bedtime may help prevent attacks in some people. Medicines such as amitriptyline and cyproheptadine can be used as a trial period of a daily dose for 1 or 2 months if symptoms actually reduce. The complications that can occur are dehydration, manifested by excess thirst or dry mouth, oliguria, dry skin, sunken eyes or cheeks, no tears when crying, exhaustion, and listlessness. Esophagitis, malarial tear, that is esophageal tear due to increased vomiting, tooth decay, and gastroparesis. The following are the references for this particular topic. Thank you for your patient listening.